Hello, everyone, and welcome to the third of our EPIC breastfeeding trainings. It's the third in a series of 4. Today's webinar is brought to you by a grant from the Indiana State Department of Health Maternal Child Health Division. And it is brought to you by Indiana Perinatal Network and the Indiana Breastfeeding Coalition in collaboration with the Indiana Rural Health Association. Here is today's education provides CMEs, and this slide shows you the education that we're providing and the objectives that we very much hope we accomplish. This slide reveals to you that I have, as the presenter today, I have no conflict of interest. The topic for today's call is lactation support services and community resources. And we are going to look at education, collaboration to help improve the lives of mothers and babies around our breastfeeding services. So the focus is very much on physicians and their offices and how the community can rise up and help physicians do their work. So my name is Tina Cardarelli, and I'm the Indiana State Breastfeeding Coordinator, and I'm also the Director of Breastfeeding Services at Indiana Perinatal Network and the Indiana Breastfeeding Coalition. So that's a lot of titles, but essentially what you should know about the work that I do is I'm very much out there in the community trying to figure out how to create better support systems in our communities. And so I'm very much going to talk about the kinds of things that are going on in the state. And there is a lot to be excited about in the state. There's a lot of infrastructure being built. If at the end of this call you have questions or you need to have my contact information for future questions, my email is at the bottom of this slide. Let's start with a little data and look at breastfeeding as it exists. And so this is a brand new document that just came out in December from the CDC. It's called Vital Signs for Breastfeeding. And the information to access this really good document is on the bottom left side of this slide. And this uses data from the National Immunization Survey of 2012. So this is the most recent data that we have on breastfeeding. The blue line at the top shows any breastfeeding. We can see that just over 80% of our moms do begin breastfeeding. And we can see that on this graph that it drops off very quickly. We can also look at the green or the aqua line, and that is exclusive breastfeeding, and we can see that that's taking the same arc down as the any breastfeeding. And that's, I don't really need to point this out, and that's the purpose of this education, is we know that the vast majority of our moms desire to breastfeed, like over 80% of them, but that number is falling off due to lack of support once women are discharged. I want to talk for a minute about the Kellogg Foundation. And so the Kellogg Foundation has had quite an influence on breastfeeding in our communities in probably the last 8 or 9 years. And so they have taken a strong lead in making sure that breastfeeding is the way that America's babies are breastfed. And they've really set the stage for the work that's being done in the community. We're very grateful in Indiana that we are working on a Kellogg grant-funded project working with teen moms that I will discuss throughout the course of this call. But I can't really put better than Dr. Gail Christopher, the VP of the Kellogg Foundation. I can't put into words maybe what the focus of the call is today. She does a very good job. So Dr. Christopher says, if we truly understand that breast milk is the best first food for babies, and our polling shows Americans do, then our institutions and communities need to make it easier for all mothers to nurse. We believe whether a woman breastfeeds shouldn't be dictated by the quality of health care she receives. And so that is really going to be our focus here today. And I do want to say that Kellogg Foundation did a very extensive poll of mothers that you can find on their website, looking at their thoughts around breastfeeding and breastfeeding care and access to care. That's very, very enlightening. I will be referencing two very important documents during my talk today. And one of them is the 2011 Surgeon General's Call to Action for Breastfeeding. And so former Surgeon General Regina Benjamin outlines recommendations for 20 action steps for society-wide actions to improve breastfeeding. And she really defines the roles and responsibilities of clinicians, employers, and other community partners. And to access this report, the website is at the bottom. This socio-ecological model is included in the Surgeon General's Call to Action. And I think it very much outlines what we're going to be talking about today is like, who are the influencers that influence families to breastfeed? And this was based on a study that was done, I believe, in 2010 that really looked at, who makes up the village of support. And you can see that the people who our education is targeted at today, the doctor's offices, the lactation professional offices and clinics, healthcare professionals in general, are really down in the core influencers. And so that is why this EPIC training is, I think, very helpful. The other document that we will be referencing today is the CDC Guide to Strategies to Support Breastfeeding Mothers and Babies. This is a very recent document. It was just produced by the CDC in the last year or so, and it is a very good outline of how communities can improve their breastfeeding care. It actually has 9 evidence-based interventional strategies for states and communities. You can choose what strategies best meet your community needs, and it gives examples. You can download this document at the website below or order hard copy, or we have copies at Indiana Perinatal Network, and you can contact me or IPN directly, and we will mail one out to you. So let's look a minute at the community strategies as outlined in the CDC document for suggestions for partners and resources. And there are 9 of them. And so the first one, we're going to look today at how hospital practices are influencing breastfeeding care. We're going to talk about professional education and opportunities there. We're going to look at access to professional support in your communities, peer support programs, workplace, early care and education, access to breastfeeding education and information. We're going to look at social marketing, and we're going to talk for a minute about addressing the marketing of infant formula. So the first strategy we're going to look at is maternity care practices or hospital practices. And so it's important to know that there's a lot going on for breastfeeding, in and around breastfeeding, as it relates to quality improvement. And there's 3 major quality improvement initiatives. The first is baby-friendly hospital designation. We currently have 9 baby-friendly designated hospitals in Indiana, and we have about 25 more and counting that are quickly moving towards designation. So that is over a third of our delivering hospitals. And that is a worldwide designation. That means that the hospitals do everything that they can do to support breastfeeding, which is also very rooted in evidence-based care. The second quality improvement initiative is the MPINC survey, and MPINC stands for Maternity Practices in Infant Nutrition Care. And this is a CDC quality initiative that is helping our hospitals to move from the care they currently provide to evidence-based practices that support breastfeeding. And the survey this year was just filled out, so hospitals have until March 1st to send that survey in. And it's really a worksheet that the CDC has provided to the hospitals to help them with this gigantic quality improvement initiative that they've been charged with. The third initiative is the Joint Commission Exclusive Breastfeeding Core Measure. And you might not be aware that Joint Commission is collecting data on the number of women in all hospitals across the country that are exclusively breastfeeding upon discharge. To read more about the Baby Friendly Hospital Initiative, the website is below, and to read more about the CDC National MPINC survey, I've also provided you with that link. So we talked a little bit about the 10 steps to baby friendly as the core maternity care practice quality improvement initiative, and I'd like to take a few minutes to really review what the 10 steps to baby friendly are. So these are the first 5 steps: that the hospitals are required to have a written policy and to routinely communicate it to their staff. They're required to train all their healthcare staff in the skills necessary to implement the policy. And the reason I have number 3 highlighted is because this is the one that is very much has to do with what happens before the people arrive at the hospital. So I call this what happens before they walk in the front door. It says that all pregnant women need to be informed about the benefits and management of breastfeeding. And the hospitals are coming to more and more understand that that cannot be done all in the hospital, that the women have to come with a basic understanding and basic information about breastfeeding. And we're going to talk a little bit more about what that looks like. Number 4 is to help mothers initiate breastfeeding within an hour after birth. And number 5 is that they must show mothers how to breastfeed and how to maintain lactation, even if they're separated from their infants. Number 6 is to give no food or drink other than breast milk unless medically indicated. 7 is practice rooming in, allowing mothers and infants to remain together 24 hours a day. 8 is encourage breastfeeding on demand. 9 is give no pacifiers or artificial nipples to breastfeeding infants. And 10, again, is a highlighted step to foster the establishment of breastfeeding support groups and refer moms to them on discharge from the hospital or birth centers. And so not only are the hospitals concerned with what happens before the women get into the hospital, so when they come in the front door of the hospital, but what happens when they leave the back door of the hospital. So they have a responsibility for how that mother is going to be supported once they leave the hospital. So it is very clear that these evidence-based care QIs that the hospitals have been charged to accomplish has led to and is leading to an enhancement and expansion of services. So as we said, the step 3 of baby friendly, they need to build the care that they're going to be providing on information that has already been provided to this mother prenatally. So they're very dependent upon those prenatal breastfeeding services. And in terms of baby-friendly step 10, after discharge, some of the things that we're seeing hospitals get involved in is a much more detailed referral to community partners. They are doing one-to-one referrals. They're doing group setting classes. They're offering weight checks, clinics, classes, phone calls, and we even have a wonderful pilot program in Indiana where we're providing tele-lactation to women via the computer. So lots of things are coming up as a result of the work that's being done in hospitals. Professional education, pretty much why we're here today. And so if we look at that Surgeon General's call to action that we're referencing, step 9, the Surgeon General says, provide breastfeeding education and training for all health professionals who care for women and children. And so the Surgeon General specifically said that we should improve breastfeeding content in our existing curriculums and that we should increase opportunities for continuing education. Some of the things that I'm only going to give one slide of recommendation. I could have given 100 slides of recommendations of some opportunities that are out there. But I've cherry picked a few, and one is this EPIC training. So this training, Series 1, it will be wrapping up on March 1st, but Series 2 will be beginning on March 15th. And so there's still time for people to participate. There are 2 very good physician trainings. WellStart International has a physician training in the School of Public Health at University of Albany, SUNY. Both have really good free physician trainings. Another thing I've seen a lot of local hospitals and communities partner on is to have a local grand rounds, possibly sponsored by the coalition or the hospital, where they can invite local physicians. And we even have a couple of hospitals in our state that do that routinely in August for World Breastfeeding Week, and that's very helpful. We have a lot of local lactation professionals that go into doctors' offices and give education to their staff, so that might be something that would be helpful for your practice to tap into. I have a newsletter that goes out that is read by about 1,400 breastfeeding educators around the state. It gives a very nice overview of what's happening clinically, what currently is in the news, and what's happening around the state. So that's a good thing to share with your staff. We have monthly webinars on breastfeeding, clinical and community topics that we provide through the Indiana Perinatal Network and the Indiana Breastfeeding Coalition. And they are on the 3rd Tuesday of each month from 2 to 3, and some of them provide continuing lactation units. We have one this afternoon at 2 o'clock. We also have, I've given you how to access these different opportunities. And we also have on August 26th, we're very excited. We're going to be looking at breastfeeding as it relates to infant and mom morbidity and mortality. And this conference is our annual breastfeeding conference. So you could send staff to this conference and it would be very helpful. So strategy number 3 is access to professional support. So as we reviewed, these short hospital stays and the amount of QI efforts that the hospitals are involved in have very much shifted the responsibility for breastfeeding support to multiple partners. And one of those partners is lactation professionals. So step 11 of the Surgeon General's call to action states that we need to ensure access to international board certified lactation consultants, IBCLCs, and that can be either in person, online, by telephone, group, in-home, and a variety of healthcare settings. So it'd be very important for physician offices to identify who the IBCLCs are in their community. One way of doing that is to contact ILCA, which is the Lactation Consultants, International Lactation Consultant Association, and they have a list of IBCLCs by zip code. So that's one possibility of identifying those people out there. So access to professional support, just a very short list. Of course, hospital lactation services are a main opportunity in your community. Physician offices, we heard in our last EPIC call from 2 physician offices that employ lactation professionals, and they're quite busy doing breastfeeding consults. And so that's, clearly physician offices are a key place. Private practice IBCLCs, and I must mention here the term licensure. So an Affordable Care Act, lactation consultants, it provides payment for lactation care by a licensed professional, and IBCLCs are not licensed to practice in Indiana. We have a licensure task force that is looking at how we can make that happen, and once we can make that happen, it's going to open billing for lactation services. It's going to be much more easy to bill for these services. So that's a very important point for doctors' offices. We can also find lactation professionals and support at the WIC office. They have peer counselors, IBCLCs, certified lactation counselors, and certified lactation specialists. Local health departments, in-home services such as nurse-family partnership, and we are seeing more and more in the communities postpartum doulas that very much are providing great service. Coalitions are a tremendous resource if you have them in your community, and we have approximately 40 coalitions around the state that are doing great work in breastfeeding. They're a great resource to the doctor's office. And we're building drop-in centers where women can go for free care all over the state, and so it'd be very helpful to find out if there's where those drop-in centers might be in your community, and if you don't have a drop-in center, how we could go about getting something for your community. We also have a unique business model in Indiana where Indiana Perinatal Network and the Indiana Breastfeeding Coalition have partnered with Walgreens to have a clinic called Well Babies at Walgreens, and we have been doing that for about 3 years, where they can actually come in and see a lactation consultant and or a pharmacist with their questions. And we're looking to expand that program out. I think we're currently going into our 3rd store, but this represents a unique business model and a unique opportunity for lots of communities, because drugstores are on every corner. So stay tuned for more information. And then, my question is, how does this expansion of service look in your community? So, maybe there are other opportunities in your community that I have not even listed that you can tap into. This is our initial pilot store where we piloted the Walgreens project. This is one of the lactating, the nursing moms. It doesn't really show the clinic, but I will say Walgreens also has a very, very strongly supports their employees too. So it's been a great project, and we've talked about it on the national level. So there's a keen interest in what we're doing in Indiana around this project. We've also written a 1-hour free training for pharmacists that Northeastern University paid for the CEs for pharmacists, and that is available, and we're happy to provide you with that information if it could be helpful in your community. I've peppered pictures that we've taken from around the state to kind of show you what's out there. This is a drop-in center that a nurse from one of the hospitals started, and I hear that every Wednesday it's kind of standing room only in downtown Indy getting to this drop-in center. So she's shown that there's a great need for these services in the community. Another picture of that center. Peer support programs, and these 3 ladies got sat for their picture to be taken at one of the drop-in centers that I went to in the Elkhart Goshen area in northern Indiana. So peer support, when we think of peer support, we think of La Leche League. This is, organization that's been around for many, many years, and they provide all kinds of support for moms by email and text and telephone and in-person meetings. And it's important in your community to find out if you have a La Leche League chapter. Another really good mothers organization is Breastfeeding USA, and it's modeled similarly to Lactation League, where it's a mom-to-mom support group, but it's a little bit newer entry into the field of peer support, and we're seeing these growing in communities all over Indiana as well. Drop-in centers we talked about. We had a grant from the CDC 2 years ago to build drop-in centers, and so we did a lot of work in our state with these free centers. Of course, the WIC program is really a core place in your community to get peer support, and they have very strong peer counselor program. There are in some communities faith-based led groups, so check your churches out, community coalition led groups, and we have many workplaces that provide support groups to their employees as well, and so it's helpful to know, particularly communities that have large employers. So we're seeing some of the auto manufacturers, they have workplace support groups. So those are great things to tap into to help support the care that we're giving. So support for breastfeeding in the workplace. I want to talk a little bit about the law. I get an awful lot of calls from people who are very confused about laws, don't know how they're protected, ask in their community, nobody seems to know. So it's helpful to be able to speak to women about how they're protected. So when we look at the state law, the first law that we've had on the books for a long time is that breastfeeding is not considered indecent exposure, and so a woman is allowed to breastfeed anywhere that she and her child are allowed to be. So that provides basic protection by the law. A law that the Indiana Perinatal Network was very instrumental in helping to get passed in 2008 is our workplace law. And so just to review a little bit about what the main points of this law is that if you are a state or political subdivision, you are required to give a reasonable paid break so that the mom can express breast milk. And you need to make a reasonable effort to provide a location, and it cannot be a toilet stall. And if you're a private employee, then you need to have 25, and you have to have 25 employees or more to otherwise you don't have to comply with the law. And you need to provide a private location, not a paid break. And it can't be a toilet stall. So that toilet stall is a big point to point out, because I get calls very, very frequently from women that ask for a lactation accommodations, and they're showing the toilet stall. And so we need to make it very clear that that is not appropriate place for lactation. One thing I want to say about the state law is it's not an enforceable law. So we hope that the employers are doing the right thing, but there are no penalties if they do not. So it's quite the opposite is true with the national law that was passed in 2010. And this law was passed and the goal was to help hourly waged earners, because it was felt that they were the women that had the least protection in the workplace, with the idea that later on the law could be amended and that salary employees could be included. And it says that they need to give people a reasonable amount of time in a space other than a bathroom, and they put a time limit on it that these accommodations need to happen up to 1 year of age. Now, one of the things that I see a lot that people in the communities could really benefit the people who they provide services to is if they understood that the national law is enforceable. So I get calls a lot where the woman is not being given accommodations, but she doesn't know she has rights. And so that's enforceable by the Federal Department of Labor, not the State Department of Labor. And they will come out to the workplace and they will do a general audit. And in that audit, they will ask about their nursing accommodations. So the woman is not, a lot of women don't want to say anything because they're afraid that they're specifically going to just look at their lactation accommodations, and that is not the case. Two great resources for workplace are the business case for breastfeeding, and this is a very comprehensive toolkit that you can get online that answers any question an employee or an employer would have or that you may have in your office. It's a great resource to have online or access to. A very recent resource that's great is the womenshealth.gov has an employer solution page where employers can go and look at similar employers and see how they have provided services. And it's just a great website. It has a lot of videos on it, and there are several Indiana businesses that are highlighted there. Goodwill Industries, Walgreens, and a zoo in Evansville have 1-minute videos on them. So it's a good website to check out at the link below. Number 6 in the CDC strategies is support for breastfeeding in early care and education. And I believe Indiana is a standout in the work that we have done. And I want to outline some of that work because it's good things that your community could tap into if you're not already doing this. These are pictures of moms and babies and child care providers in actual Indiana child cares. Another mom here. This is a feeding tips that the child care providers asked us for. They wanted to know basic information about handling breast milk, storage, and some of the nuances of feeding a breastfed baby. And I can't tell you how many thousands of these are out there. I'd guess about 10,000. It's been printed many times. And these are very reasonable guidelines. Some hospitals are giving them out at discharge, like refrigerator magnets, and you can contact IPN if this might be a helpful handout for your patients. The child cares that receive our training, so we have a training for child cares that is up on our Indiana Perinatal Network website. There's access to it at this link below, and people can download that and train it. Some coalitions have trained child cares in their community. We have so many people out there that are providing this training. When they do receive the training, they get this decal to put on their child care. We care for breastfed babies. And I was recently traveling, and you'll see the picture on the top right. I was going into a building that houses a lot of different health agencies, and I saw this decal on the door and took a picture. One thing that you can do as a physician office is to display the universal breastfeeding welcome here decal on your window to let your patients know that breastfeeding is welcome there. And those decals are available in any number of places where you can download them online. You can go to the Indiana Perinatal Network website and look at resources for child care providers and breastfeeding families. One of the things I'll point out here is that Magnet is there, but there are 2 videos that we collaborated with the Oregon Breastfeeding Coalition to make that have been put on YouTube. And one's a 3-minute video for childcare providers, but the other one is a 3-minute video for women going back to work. And that would be a great resource to give to your patients who will be returning to work. I'm very excited to talk about the support that's going on in breastfeeding and education because we just spent the last 3 years working with high schools and communities around Indiana to improve access to breastfeeding care for teen moms. It's been a fascinating, fascinating program, and so excited to have Kellogg Foundation funding a breastfeeding project in Indiana. So it's something we're very, very proud of. And this is one of the programs where the moms in South Bend, it's called the School Age Mother Program, where moms can come in and do their studies, bring their babies, and it's been a very exciting program to be involved in. So it would be helpful to know if your high school is supporting teen moms and what resources are out there. We set up lactation areas in many high schools around the state. The teens are using it, but also the teachers are using it. And so it's a supportive environment. And so that's helpful as a physician office to know if those kinds of things exist in your community. Two things that you can access in terms of resources is there's a curriculum that is part of this Kellogg grant. That's a curriculum for secondary education. It's called Life's Best Beginnings that can be downloaded here and taught. And sometimes lactation people in the community will be invited in to teach this as part of child development or family consumer science classes. There's also a teen and school resource page on the Indiana Perinatal Network website that's really helpful if you have teen patients and you're looking for services or information. Access to breastfeeding education information. So I peppered through this presentation pictures of things that are going around Indiana, and this is a success story. In this picture, you'll see Kathy McCoy, a long time nurse and lactation consultant at a downtown hospital in Indianapolis. And her goal in her retirement was to open a drop-in center where women could go for free care. And it has just taken off like wildfire. And, just wanted to show you some of the success stories that are possible. So the primary goal with education and information is to help our families see breastfeeding as normal. And also, you see more and more about including our dads. So this isn't just education for the moms who will be breastfeeding. This is including families, especially dads. And developing a positive attitude about breastfeeding is really important, and to give consistent and cohesive messaging. I've seen many parent surveys, and the number one thing that stands out in them is that we give a very disjointed message, that they hear one thing from one provider and something else in the hospital and something else in the WIC program and something else from their friends and family. And so it just creates confusion. And so we're working really hard in Indiana to ask providers, what is your message? And is it consistent and cohesive with what everybody else is teaching in the community? There was a Cochrane review in 2005, and it's not a newer study, but it stands up, that looked at personalized education as being especially effective. They found printed materials alone pretty much had no effect. But they found that combining personalized education with printed materials definitely had an effect on initiation and duration. Something to think about. Social marketing. And so I guess, we live in a time where we cannot ignore social marketing as a force in the work that we do. And so Kellogg poll showed that 86% of Americans turn to their health professional as their primary source of information. And last EPIC call, we had presenters who talked about their social media and their web presence for breastfeeding and how that was drawing patients to them. And so a reminder that over 80% of women are starting to breastfeed. CDC studies showed that over 80% of women strongly desire to breastfeed. So the vast majority of your patients have a desire for this type of care. So we're finding, I was typing in doctor's offices to see what doctor's offices had for breastfeeding information on their websites. And some of them are blogging, some of them have some basic information on social media and basic information on their website. And so something to think about in terms of enhancing your breastfeeding services and education. This is a screenshot I took of a doctor's office website that I found that does quite a bit of breastfeeding, provides quite a bit of services, and they had quite an extensive area on the website. Addressing the marketing of infant formula. So one of the influences or the strategies outlined by the CDC is to reduce the marketing of infant formula. And we're doing that very, very effectively in the hospitals by removing discharge bags in the hospitals. But what I'm finding as I travel around that those discharge bags are finding their way into doctors' offices. And I know they have a place in the doctor's office in terms of the doctor prescribing certain things, but I'm seeing them stocked up in some waiting rooms I've gone in. And so reducing, it's been shown that formula sampling reduces breastfeeding duration and exclusivity. The study that's most often cited says that there's a woman that is exposed to formula marketing samples is 39% less likely to be exclusively breastfeeding at 6 weeks. So something to consider. The Surgeon General flagged the risks of formula marketing in her 2011 call to action to support breastfeeding. And in it said that we must ensure that healthcare clinicians do not serve as advertisers for infant formula in order to avoid undermining breastfeeding. And there is a link to a very good fact sheet. The Citizens.org has taken on formula marketing as not in the best interest of the American public, and they have a lot of great resources on there for doctors' offices, and you could check that out. So all of the major health entities have pretty much come out with a statement saying that we should limit the marketing of infant formula. I point in particular to the 2012 AAP resolution to counter this practice, and they said in their statement that they advised pediatricians not to provide formula company gift bags, coupons, and industry authored handouts to the parents of newborns and infants in office and clinic settings. And I like that they include handouts because many offices I go into, sometimes the only handouts that are available are from formula companies, and there are better ones out there. So again, there's that link for more information. I love this picture because my question as we wrap this up is, how does your community support your patients? And so what does that look like? It's very unique in every community. And I love this picture because several years ago, I was invited to come and talk one evening at in a very small community about starting a coalition and getting things organized around breastfeeding in the community. And I actually thought about 5 people were going to be in the room. And when I showed up, the last head count I took, there were 216 people that had come out to learn about what their community could do to support breastfeeding. There were actually ministers from the churches and all kinds of people. And that shows like what the resources that exist in the community that we can all tap into. I love this in terms of referrals and collaboration. This is Elkhart, Indiana. Several years ago, the economy hit them hard, and it really shut down lactation services in their hospital. And these nurses, lactation consultants, started a drop-in center that has just grown enormously and provided huge services in a large geographical area. So just another inspiration. So I think that when we talk about referrals and collaboration, I pretty much have to just throw out a lot of questions to you. Where do you commonly refer out to? Are patients being referred to you? Can you expand your network? Do you have referral information for your community? One of the top things that I hear as I travel around the state when I ask doctors what we can do for them, they say, give us a very complete referral sheet that we can tap into for our patients very easily, whether online or whether you bring us a laminated copy. It's like, that's what we need. And so if your community doesn't have that, or you don't know where it is, I would reach out to your hospital, to your coalition, and find out if they can provide that. I'm sure they would love to organize that. Is there a coalition and resource in your community? Communities with coalitions definitely have the edge, and it's a place you can refer people to. A lot of coalitions meet monthly, but we even have a model where a coalition meets annually, and they bring all the people in the community together and they talk about what their goals are for the next year and how they can help each other. How is your community talking to each other, especially in those first few days after discharge? When most women get frustrated and are likely to stop breastfeeding. So those are the crucial times. We saw speakers at our last EPIC call that talked about how they have a way to communicate with WIC, with the hospital, with the coalition, with the doulas in their community. And that is really the gold standard of model that we're looking for. These are some helpful websites. So it's nice to be able to give some websites to our moms that we know are going to give very good evidence-based information. I would love to see the moms get signed up for Text for Babies, as there are regular breastfeeding messages. Breastfeeding Made Simple is a great website and one that's recommended by the CDC, and Kelly Mom is probably the recognized site that most moms go to. So those are 3 good resources to have on hand. Questions? I do want to remind you, while we're waiting for questions, that our next website is on March 1st. It will feature Dr. Amanda Dornfield, who is a family practice doctor in Columbus, who's doing some amazing work in her community and in her practice to enhance breastfeeding care. And she's going to have a very informal question and answer. I'm excited. Dr. Dornfield has a lot to teach. I also want to remind you that EPIC 2, so we will be repeating this 4-part series, begins on March 15th, and we would love it if you would spread the word.
Thank you very much, Tina. So you guys have the ability to ask questions via the Q&A. If you'll use your mouse to scroll over the bottom of the screen, select Q&A, and we are ready to take your questions. All right, Tina, I'll give you a question.
Okay.
You mentioned, we talked about the steps for baby-friendly hospitals. Was the website listed? I can't remember where folks go to get those resources, and then once they feel that they meet those, is it the perinatal network they go back to get that certification, or is it ISDH?
No, that's a very good question. That is a great question, actually. So baby friendly is an international designation. So there are close to 30,000 hospitals worldwide that have baby friendly designation, and some entire countries have all of their hospitals are baby friendly. Baby friendly was very slow to get started in this state and in this country, and the certifier is Baby Friendly USA, and there is a very formal process. It takes an average of about 3 years to become baby friendly, because there's a lot of QI that has to happen. But Indiana Perinatal Network is very happy, because we're really acting as a helper organization to a lot of these hospitals to help them to do the work to get to baby friendly. We're now seeing California just passed a law where all of their hospitals need to attain baby friendly or the equivalent, and I think it's by 2018. I'm sure it is, and so it's a very it's an international designation that comes from World Health Organization and UNICEF. So I'm glad you asked that.
All right, other questions?
I'd like to think no questions is good news, that
Tina, do you want to give out your email address just in case folks are shy to ask questions on the webinar here today?
Yeah, well, it's a very long email. It's T Cardarelli, C-A-R-D as in David, A-R-E-L-L-I at indianaperinatal.org.
Okay.
And, you know, please see me as a resource in your community as you are working on improving services or enhancing the services that you currently give. And if there are no questions, I thank you for your participation today, and I thank you for the work that you are doing. It's making a difference. And if you look at all the numbers, you can see that Indiana is improving and in our breastfeeding outcomes, and that's exciting to be collaborating with all of you on this work.
Thank you very much.
Okay, goodbye, everyone.